It was a sunny Saturday morning. Children were laughing on the swings, a group of friends were playing frisbee. Everything seemed perfect. Suddenly, a man walking collapsed. He wasn't moving. People rushed over, fear etched on their faces. No one knew what to do. This man was experiencing sudden cardiac arrest. Cardiac arrest is a serious medical emergency that happens when the heart suddenly stops beating. This prevents blood from flowing to the brain and other vital organs. Without immediate medical attention, it can be fatal. Knowing the signs of cardiac arrest and how to perform CPR can be the difference between life and death. In those crucial moments before medical professionals arrive, you can become a lifeline. This essay will guide you on how to identify cardiac arrest and provide potentially life-saving assistance.
Cardiac arrest can strike anyone, anytime, often without warning. Recognizing its symptoms is the first step towards saving a life. A person experiencing cardiac arrest will suddenly collapse and lose consciousness. They will stop breathing, or their breathing may seem irregular and gasping. Since the heart is no longer pumping blood effectively, the person's skin may turn pale or bluish, especially around the lips and fingertips. They will also be unresponsive to any stimulation. If you see someone exhibiting these signs, call for help immediately. Then, even if you're unsure of the exact cause, it's crucial to start CPR right away.
CPR stands for cardiopulmonary resuscitation. It is a life-saving technique that helps maintain blood flow to the brain and heart when someone's heart stops beating. CPR involves chest compressions and rescue breaths. Chest compressions help mimic the heart's pumping action, circulating blood to vital organs. Rescue breaths deliver oxygen to the lungs, which can then be circulated throughout the body. While the thought of performing CPR might seem daunting, it's actually a simple procedure that anyone can learn. Remember, every second counts during cardiac arrest, and starting CPR immediately can significantly increase the chances of survival. Here's a simplified guide to performing CPR on an adult. First, gently tap the person's shoulder and ask loudly, "Are you okay?" If there's no response, they are likely unconscious. Next, immediately call 911 or your local emergency number. If someone else is nearby, ask them to call while you begin CPR. Then, lay the person on their back on a firm, flat surface. Now, place the heel of one hand on the center of the person's chest, right between the nipples. Place your other hand on top of the first hand, interlacing your fingers. Position yourself directly above the person's chest, keeping your arms straight. Push down hard and fast on the chest, compressing it at least 2 inches deep. Aim for a rate of 100 to 120 compressions per minute. Continue giving chest compressions until medical professionals arrive. If you're trained in CPR and feel comfortable, you can give rescue breaths after every 30 chest compressions.
The power of AED, a shock that can restart a heart. An automated external defibrillator, or AED, is a portable electronic device that can deliver an electric shock to the heart. This shock can potentially restore a normal heart rhythm in cases of cardiac arrest. AEDs are designed to be used by anyone, even without formal medical training. They come with voice instructions and visual prompts that guide you through the process. If an AED is available, use it as soon as possible. It can significantly increase the chances of survival when used alongside CPR.
The impact of CPR and AED: imagine a crowded sports event. The excitement in the air, the cheers, and then suddenly someone collapses. A bystander quickly steps in, performs CPR, and uses an AED. Within moments, the person's heart starts beating again. They survive thanks to the quick actions taken by someone who knew what to do. Every day, stories like these unfold around the world. Ordinary people becoming heroes, saving lives with the skills they've learned. These aren't just statistics, these are real lives, real families, and real futures saved. Meet Sarah, a schoolteacher who saved her colleague during a staff meeting, or John, a bus driver who saved a passenger on his route. These individuals took the time to learn CPR and AED, and when the moment came, they made a life-saving difference. You too can be part of these stories. By learning CPR and how to use an AED, you equip yourself with the power to save lives. It's not just about knowledge, it's about the impact you can have on your community, your loved ones, and even strangers. Join the ranks of everyday heroes. Be prepared, be confident, and be ready to save a life. Well, and you can be the next lifesaver. Now, let's take the next step together.
Be the difference. Learn CPR and AED today. Cardiac arrest can happen to anyone, anywhere. Being prepared and knowing how to respond can mean the difference between life and death. Learning CPR and how to use an AED is easier than you think. Numerous organizations offer CPR and AED training courses for the general public. By taking the time to learn these life-saving skills, you can become a valuable asset in an emergency situation. You might even save someone's life. Remember, in cardiac arrest, every second counts, and your actions can make all the difference. Please like, share, and subscribe to our channel to stay informed and help spread the word about life-saving skills.